Development of face, nose, and palate. The 12th of May 2015. Development of face, nose, and palate. Dr. Archana Rani, Associate Professor, Department of Anatomy, KGMU UP, Lucknow. Embryo at 4 to 5 weeks, lateral view. Introduction. Face is derived from the following structures that lie around the stomatodeum, 4th week. Frontonasal process. First pharyngeal, mandibular, arch of each side. A. Maxillary process. B. Mandibular process, formation of mandibular and maxillary processes, 4th week. The single frontonasal prominence ventral to the forebrain. The paired maxillary prominences develop from the cranial part of first branchial arch. The paired mandibular prominences develop from the caudal part of first. 5 facial primordia appear as prominences around the stomodeum. The single frontonasal prominence. The paired maxillary prominences. The paired mandibular prominences. F and P. 1 frontonasal prominence. 2 maxillary prominences. 2 mandibular prominences. Stomatodium. Further development of face. Formation of nasal placodes and lens placodes, 4th week. Nasal placodes sinks below to form nasal pits, 5th week. Elevations of the nasal pits form the medial and lateral nasal processes. Nasal placodes are primordia of the nose and nasal cavities. Formation of lower lip. Formation of upper lip. Formation of nose and cheeks. Formation of external ear, 6th week. Formation of eyes, 7th-8th week. Development of nasal cavities. Formation of nasal septum. Development of paranasal sinuses. They develop as diverticulae of the walls of the nasal cavity. Maxillary sinuses and few anterior and posterior ethmoidal air cells develop in fetal life. Frontal and sphenoidal sinuses develop after birth. From a 3-month-old fetus, showing ethmoid and maxillary sinuses, derivatives of facial components. Frontonasal prominence forms the forehead and a bridge of the nose. Frontal and nasal bones. Maxillary prominences form the upper cheek regions and most of the upper lip. Maxilla, zygomatic bone and secondary palate. Mandibular prominences fuse and form the chin, lower lip, and lower cheek regions. Mandible. The lateral nasal prominences form the alley of the nose. The medial nasal prominences fuse and form the intermaxillary segment. Development of palate, palatogenesis. The medial nasal swellings enlarge, grow medially and merge with each other in the midline to form the intermaxillary segment. Human embryo, 7 weeks. Intermaxillary segment gives rise to the philtrum of lip. Premaxillary part of the maxilla, that bears the upper 4 incisors and the associated gums. Primary palate, region of hard palate just posterior to the upper incisors. Palatogenesis begins at the end of the 5th week. Gets completed by the end of the 12th week. The most critical period for the development of palate is from the end of 6th week to the beginning of 9th week. The palate develops from 2 primordia. The primary palate. The secondary palate. The primary palate begins to develop early in the 6th week. From the deep part of the intermaxillary segment, as median palatine process, lies behind the premaxillary part of the maxilla. Fuses with the developing secondary palate. The primary palate represents only a small part lying anterior to the incisive fossa of the adult hard palate. Primary palate. Hard palate. Secondary palate. Soft palate. The secondary palate is the primordia of hard and soft palate posterior to the incisive fossa. Begins to develop early in the 6th week. From the internal aspect of the maxillary processes, as lateral palatine process. With the development of the jaws, the tongue moves inferiorly. In the beginning, the lateral palatine processes project infero-medially on each side of the tongue. With the development of the jaws, the tongue moves inferiorly. During 7th and 8th weeks, the lateral palatine processes elongate and ascend to a horizontal position above the tongue. Gradually the lateral palatine processes grow medially and fuse in the median plane. Also fuse with the posterior part of the primary palate and the nasal septum. Fusion with the nasal septum begins anteriorly during 9th week, extends posteriorly and is completed by 12th week. Bone develops in the anterior part to form the hard palate. The posterior part develops as muscular soft palate. Embryological subdivisions of the palate. Anomalies related to face, nose, and palate lead to difficulty in breathing, feeding, sucking, swallowing. Facial clefts. Failure of the embryonic facial prominences to fuse properly. May be unilateral or bilateral. May involve lips only, cleft lip. Palate only, cleft palate. Lip and palate, cleft lip and palate. Region of nasolacrimal groove, facial clefts. Lead to difficulty in breathing, feeding, sucking, swallowing. And speech. Median cleft lip results from failure of the medial nasal prominences to merge and form the intermaxillary segments. Unilateral cleft lip result from failure of the maxillary prominence to merge with the medial nasal prominence on the affected side. Bilateral cleft lip results due to failure of maxillary prominences to meet and unite with the medial nasal prominences on both sides. Median cleft lip. Unilateral cleft lip. Bilateral cleft lip, anterior/posterior to incisive foramen, unilateral/bilateral. Oblique facial cleft results from failure of the maxillary prominence to fuse with the lateral nasal prominence. Cleft palate leaves the nasal and oral cavities connected and results in nursing problem for the newborn. May be anterior/posterior to incisive foramen. Unilateral/bilateral. Isolated/associated with cleft lips. Oblique facial cleft. Cleft lip, cleft jaw and cleft palate. Varieties of hair lip. Developmental anomalies of face. Cyclops and proboscis. Oblique facial cleft. Cleft lip coupled with clefts of the anterior palate or entire palate. Varieties of cleft palate. Other anomalies: mandibulofacial dysostosis, Treacher-Collins syndrome, retrognathia and agnathia. Hypertelorism. References: 1. Langman's Medical Embryology, 11th edition. 3. I.B. Singh. Human Embryology, 10th edition. McHughes. The median part of upper lip is formed by a. frontonasal process, b. medial nasal process, c. lateral nasal process, d. maxillary process. McHughes. 2. Oblique facial cleft result from a. non-fusion of maxillary and lateral nasal process, b. non-fusion of maxillary and medial nasal process, c. non-fusion of maxillary and mandibular processes, d. non-fusion of two mandibular processes. McHughes. 3. Palatal process is an outgrowth from a. maxillary process, b. medial nasal process, c. mandibular process, d. frontonasal process. McHughes. 4. Premaxilla is derived from A. Maxillary process, B. Medial nasal process, C. Mandibular process, D. Frontonasal process.